Imagine leaning your head forward, and suddenly a sharp electrical shock rips down your spine and shoots into your limbs. This sudden, alarming sensation is known as Lermit's sign. Or picture stepping into a warm shower, only to find that as your body temperature rises, your vision goes blurry and moving your eyes becomes painful. This is called Uthoff's phenomenon. These symptoms seem disconnected: a physical shock in the back and temporary vision issues triggered by heat. This illustrates the central difficulty of multiple sclerosis: how one condition can trigger temporary symptoms across completely different physiological systems. Because these signs are temporary and vary between patients, standard screening methods often fall short. There is no single blood test that can confirm a patient has MS, leaving neurologists without a simple yes or no metric. To reach a diagnosis, neurologists look for evidence that the disease is operating across two specific dimensions: dissemination in space and time. To understand the space dimension, we look at the wiring of the central nervous system. Your brain and spinal cord are packed with nerve cells, and the long fibers of these cells are wrapped in a fatty layer called the myelin sheath. Much like the rubber insulation around a copper wire, this sheath allows electrical signals to travel at high speeds. But in MS, the immune system incorrectly identifies that myelin insulation as a foreign threat, like the Epstein-Barr virus. Through a process called molecular mimicry, immune cells cross the blood-brain barrier. Because the proteins on your myelin look structurally similar to the virus proteins, the immune system confuses the two and launches an attack on your own tissue. This inflammatory attack strips the myelin away, leaving behind dense, rigid scar tissue or plaques. In fact, the word sclerosis means scars. Without that insulation, the electrical impulses short-circuit, slow down, or stop altogether. As we see in this model of the brain and brainstem, myelin-wrapped axons make up nearly every part of the structure. This demyelination can happen anywhere in this vast territory. That is, dissemination in space. A scar on the optic nerve affects vision, while a scar in the spinal cord causes muscle spasms. But this immune destruction does not happen all at once. It rolls out in distinct, unpredictable waves, which brings us to the second dimension: time. To track this timeline, neurologists rely on an MRI of the brain and spinal cord. They look for the physical aftermath of staggered attacks by identifying distinct bright white plaques scattered throughout the white matter. Doctors also look for ongoing chemical evidence. By performing a lumbar puncture or spinal tap, they analyze the cerebrospinal fluid for elevated antibodies. When these show up on lab results as oligoclonal bands, it confirms the immune system is active inside the central nervous system. To connect the biological evidence to the physical symptoms, doctors use the 24-hour rule. For a patient to have a confirmed flare, their neurological symptoms must last continuously for at least 24 hours. This standard filters out pseudo-attacks. If a patient's symptoms flare up temporarily because they are running a fever or standing in the hot sun, it is usually existing nerve damage reacting to heat, not a new immune attack. By mapping these physical lesions on an MRI alongside chronologically confirmed 24-hour flares, neurologists find the evidence required to diagnose the disease. Once the diagnosis is confirmed, medical intervention follows a dual approach. Because the disease operates across space and time, the strategy focuses on two fronts: halting active damage today and preventing future spread. During a severe confirmed flare-up, doctors use an acute strategy. High doses of intravenous corticosteroids, like methylprednisolone, or a blood filtering process called plasmapheresis, are used to aggressively reduce active inflammation. For long-term management, patients use disease-modifying therapies, such as interferon beta. These medications work to continually suppress the immune system and stop those cells from attacking the myelin in the first place. Pharmacology works alongside environmental management to protect long-term brain health. Patients focus on staying hydrated, balancing exercise with rest, and taking daily vitamin D3 supplements to support their system. However, some lifestyle choices can actively undermine this effort. Smoking is a significant risk factor because it is highly pro-inflammatory. Inhaling these toxins can accelerate the destruction of myelin and speed up the overall progression of the disease. While multiple sclerosis remains an unpredictable condition, Identifying its spatial and temporal patterns allows modern medicine to shift from merely reacting to symptoms to actively managing the disease's trajectory.